Hi, my name is Dr. Lyly Nguyen, otherwise known as Dr. Lyly. My day as a plastic surgeon starts very early in the morning. This is where I spend a lot of time in the operating room. I see patients as consultations and see patients as post-operative visits to make sure that they're happy with the results and I've answered every question that they have. My training began after 4 years of college at UCSD, and then I went into 4 years of medical school. After that, I did a rigorous 5-year general surgery training program where I became a board-certified general surgeon. After that, I did 1 year of plastic surgery research fellowship and then a plastic surgery residency at Vanderbilt University. I always thought I was going to be a breast cancer surgeon, but after the removal of breast cancer, it was the reconstructive part that really engaged me. And it was kind of through this time that I felt that an emotional and mental well-being is very closely intertwined with the physical well-being. But my favorite parts of plastic surgery are definitely working on the breasts and working on body contouring as well as facial aesthetic procedures.
Hi, are you Megan?
Yes.
I'm Dr. Lyly. Nice
So
to
nice
meet
to meet
you.
you.
Okay, so what brings you in today?
So I'm looking to get a little bit of my loose skin from the top of my belly to see if I can get that tightened.
Okay.
I also have had a breast procedure in the past. I had a lift with an implant, but I'm looking to decrease the size of my implant and also maybe create a little more cleavage on the top.
Okay, so we'll take a look in a minute. We're going to start with some breast measurements. We'll talk a little bit about different implant choices based on what is appropriate for your unique measurements, and then we're going to take a look at the abdomen. I think to have a very strong patient-doctor relationship is probably the most important part of a patient's journey. And I think that because your implants have sort of settled down into a more natural position and you're wanting them up a little bit higher, I think it's really important to maybe place a piece of mesh on the undersurface of your implant. I want my patients to trust that I have their best interest in mind, and I want to be honest with my patients and set realistic goals and expectations. I feel that if you're considering plastic surgery, you should be doing plastic surgery for yourself and not for anybody else. Having been raised in Southern California, but having lived in New York, Miami, and Nashville, I have seen beauty trends across the nation. Being of Asian descent, but growing up with American ideals, I've seen these beauty trends come and go. And what I've come to learn is that beauty is multifaceted. There's no perfect size or shape. Beauty should be individualized to the patient that accentuates their own unique features. I feel like I have a unique privilege to play this special aspect in this patient's life, and even though I take plastic surgery as an artistic craft very seriously, I never forget the human element.